All right, quickly, let me cut across to this story that affects all of us in today's day. We're all taking supplements in one form or the other. You have a recent survey on turmeric supplements. So turmeric is hailed as a miracle spice used for centuries in Indian kitchens and even longer in traditional medicine. A new study now by the Drug-Induced Liver Injury Network has now flagged a worrying trend that turmeric supplements are now being linked to liver damage. Between 2004 to 2022, researchers have recorded multiple cases of liver injury in people taking turmeric supplements. Symptoms ranges from fatigue, nausea, jaundice to, in one case, acute liver failure. Some had to even be hospitalized. The turmeric isn't alone. In fact, dietary supplements are a booming industry. Vitamins, fish oil, protein powders, plant-based antioxidants. Most of us are popping at least one a day. And because they're sold over the counter, many take them without any medical guidance, unaware of how they actually interact with our body. We're still popping it without anyone telling you that this is what you're deficient of and this is what you should be having. You just hear that this is good for your body and you pop a supplement. That's more or less the trend now. Now, many of these supplements reach the market without any rigorous clinical trials as well. So you don't even know if these vitamins that you're consuming are really fit for your body. So where's the check? Who's really monitoring what we're consuming in the name of wellness? Let me take you through tonight. Joining us is Dr. Neeraj Nisha, Additional Professor, Department of Medicine, AIIMS, New Delhi. Also Dr. Shikha Sharma, Founder, One Health, veteran nutritionist. Thank you, both of you. Dr. Neeraj, if I could start with you, a quick take on how common is supplement-induced liver injury and how should people really spot the early signs?
So in today's fast world and I will say world of social media, this nutritional supplements have become more of fad. People think that these supplements are replacement for healthy nutritious diet, which is something which is affecting a large chunk of population now. So what I will say that supplements should not be taken as replacement for the normal, healthy, balanced diet which we always advocate for our patients or for in general for our normal population as well. So this habit of taking supplement for everything and thinking that this is going to benefit, there will be no harm in taking this supplement. That is something which is worrisome.
So without doctor's guidance is where the problem lies. But ma'am, as a nutritionist yourself, Dr. Shikha, is turmeric safe in food but risky in supplement? This question is a little confusing. What's really the difference in your view?
See, definitely, I think it's a very important question because when you look at food and when you look at turmeric in food, now turmeric is coming with synergistic molecules. That means when you're having turmeric in its natural state, there are the synergistic molecules which counterbalance that turmeric impact and also potentiate some parts of the. So when you are having a product, when you have it in a product form, you are basically having an extracted thing. Like in the case of turmeric, curcumin, the active flavonoid is extracted and then put in a capsule. First thing what happens when you do this extraction is that it becomes highly available, much more than what it would be available along with its countering. So in a turmeric, like in a normal kitchen, it would have a counter thing also in the molecule. But here it is just the active compound without its countering element. Second thing is the dosage is very high. So what you get in the kitchen, the dosage here would be 10 times, 20 times. Third thing is that because you're having in a capsule form, so normally when you have turmeric, you will have only little bit because it's going in a dish or it's going in a particular way. But when you have it in a capsule, you can pop 3 capsules, 4 capsules. There is no control.
Yeah.
And most of these side effects are because of overdose. I mean, any good thing, any vitamin, anything which you would take, like for example, when I was working in the hospital as a doctor, at that time we used to, for women who were expecting and they had very low hemoglobin, we would give iron supplements because the pregnancy was due and we did not have time to build the hemoglobin. We would give iron supplements. But it does not mean that something which is good in a dose, you can just have excessive and then it will still be good. No, it will be harmful. So the same goes for all these nutraceutical products. The dosage has to be controlled and it has to be explained to the patient. I think today
Right.
what is happening, people are popping pills just like that.
A quick word of advice from you on those taking multiple supplements daily without medical advice. What would you say?
I would say it's highly dangerous because at the end of the day, these supplements are very active compounds. I mean, yes, they're herbal, they're natural, but it does not mean that you can overdose yourself, because that's what people are doing. So I think there should be some regulation. Only there should be some training to the so that people know what they are taking. B, I think some supplements should come under uh, licensed nutritionists so that they can advise in the
Yeah.
right way. Because today, I think people watch something on Instagram, they watch an advertisement, they watch
Correct.
something and start pumping all these supplements.
A last word from Dr. Neeraj.
So again, I will just echo the words of Dr. Shikha. It's what happens, especially those patients who have comorbidities, who are on multiple other medications. If you take all these supplements without guidance of a doctor, then what will happen that these drugs may actually interact with the medications which are essential for you. Say somebody is on blood thinner and you are taking a particular supplement which may affect the either potentiate the effect of that blood thinner or decrease the effect of that blood thinner, that could be catastrophic for that particular person. So all I will say, whatever pill you are popping, it's not safe. Any external medication which you are taking, which you are subjecting your body to, that will have some side effect if not taken properly. So
I think
excess
the
of everything
survey
is bad.
establishes just that. Thank you very
Yeah.
much, both of you, Dr. Neeraj and Dr. Shikha, for joining us with your expertise.